Well, good morning, everyone. I am happy to be joining you from the office of Vivify Plastic Surgery this morning, where we have a lot to dive into, a lot of hot topics to dive into as well. I'm happy to introduce you to Dr. Dallas Buchanan. Good morning.
Good morning. How are you?
Good, good. So tell us a little bit about what we're going to talk about today. And you offer a lot of services both here and then I know at some off-locations sites as well.
Yeah, so here at our practice at Vivify Plastic Surgery, we've been open since September of last year. And so here in the office, we don't do any surgical procedures, mostly non-invasive, minimally invasive things, and we do our surgical procedures at several off-site surgery centers that we're accredited with.
So what type of services are being done here? I mean, this is such kind of, again, a popular kind of service, and people are wanting these services more. What is it that you're doing, the procedures?
So our procedures here in the office that we do, the minimally invasive procedures, are things like Botox, injectables, skin treatments, those sorts of things.
All right.
All the surgical stuff is done at another facility.
Which we're going to talk about this morning. We're talking about our main focus is implants, which again are still extremely popular. Talk about what it is that you're using here and why this is so important to make sure that people know the correct place, the correct doctor to see as well.
Right. So here at Vivify Plastic Surgery, we specialize in a lot of things, general cosmetic surgery, that's face, breast, and body, and also non-surgical things. But in terms of what we're talking about today, we're going to be talking about breast implants. And we know from our statistics that breast implant is the most common procedure that we perform. So it's something that's on a lot of people's mind and something a lot of people are thinking about. And so what we want to focus on today is some new technology that's out there in terms of breast implant options. And I know breast implant's been something that's been in the news a lot recently. And so we want to just try to make sure that people get good information.
And let's talk about that. That was my first question when I came in and met you. And how has the technology changed from what your team was doing maybe 10, 15 years ago? Just like everything else, I can imagine a lot has changed.
Yeah, absolutely. So it seems like in plastic surgery, it's one of the places where technology moves really fast, and sort of the media is always on what the new hot thing is. And so today, in terms of breast implants, we're talking about a new generation of breast implants called a structured breast implant, or structured saline breast implant called the Ideal Implant. And so it's one of the newest technologies in terms of breast implant options for patients. Traditionally, traditional old saline implants or silicone implants are something that's made a lot of stories in the news. And so this is a new generation of a type of saline implant called a structured implant that's an option for patients.
So what are the benefits to using this particular implant?
So this implant is a saline filled implant. So one of the things that we know about saline filled implants is it's easy to detect a rupture. So the inside of the implant, and here's the implant here. So the inside of this implant is filled with salt water. So it's a natural material, the same thing that's running in our veins or that we give in an IV bag. So we know that if there's a rupture of this implant, the saline is just a natural product that's reabsorbed into your body, and you know immediately that the implant is ruptured if there's a tear in the implant or it's broken, because the implant will deflate and the saline will be reabsorbed. So patients can easily detect a rupture. Whereas with the silicone implant, if this implant cracks or the shell cracks on the implant, you can have what's called a silent rupture, where you may not know the implant's ruptured.
When it comes to the safety of implants, and again, because this is in the news a lot lately, what do you want patients to know, and how can you make sure patients are getting the right information when there is so much out there?
Absolutely. So there's kind of two big things you worry about with implants. Number one, implant rupture, or the breaking of the implant. And number two is scar tissue forming around the implant, what we call capsular contracture. For all the implants on the market, the Ideal Implant, for the 8-year data that we have available, has the best rates of lowest rate of capsular contracture and the lowest rate of rupture for all those implants. And so really the thing is, when you get information from other sources, whether it's Dr. Google or Facebook machine, whatever, all those sources out there, you really need to make sure that if you have concerns about having an implant procedure or about your current implants that you have, that you're getting your information from your plastic surgeon who's board certified by the American Board of Plastic Surgery.
And if you can, before we wrap up, touch on that again, because I do want you to brag on you and your team a little bit, because I do think that is so important that you're going to the specialist who knows exactly what to look for, you know.
Yeah, there's a lot of marketing in our industry, and a lot of things that sort of a lot of words that trick people into a lot of things, you know, double, triple, quadruple board certified. The only board that is recognized by the American Board of Medical Specialties is the American Board of Plastic Surgery. So cosmetic surgeons, aesthetic surgeons, all these other people, they are not board certified in plastic surgery.
All right, well, good to know. Thank you so much for your time this morning. Certainly, we're going to put their information on our website as well, so it's easy for you to find. And thank you so much. We appreciate it, Doctor.
My pleasure. Thanks for coming.
And by the way, we also want to let you know that they will be doing an open house this Saturday, May 18th from noon to 2 for patients to come in, see the practice, meet the doctor, and discuss any procedures of interest. Just visit their website or call the number that you see right there on the screen for more info.